Hey everyone, Dr. Alex here. A quick interlude before we go into this posture rehab exercise routine. What I want to do is talk a little bit about how to use this routine. So these are the exercises I give most to my patients to help improve the health of their spine, their strength and their mobility into the muscles that extend their spine backwards, and to promote the possibility of the spine bending backwards and helping them with their underlying structure. So I say structure instead of posture because structure refers to the actual orientation or the stacking of the vertebra. Posture is how one holds oneself. The posture of the CN Tower can sway in the wind, but the structure is straight versus, say, the Leaning Tower. So in our practice, one of the things we focus on is helping to restore a normal structure of the spine, making sure things are stacked up, because this affects your health. It affects the health of the nervous system and the way the nerves that leave the neck, how they talk to the rest of the body, most specifically, what goes down into the arms. It affects how the lungs work, how you breathe, the type of breathing pattern you use. It affects how the shoulder and the shoulder blades move, and it's going to affect the spine and most of the rest of the spine, which is going to affect your health. In some cases, it causes pain if that head is shifted forward. In some cases, it doesn't. It very much depends on the person and the millions of other factors that can determine whether someone has pain or not. So, if you do these exercises very regularly, they will help your posture, they should help the structure of the spine, and they will make your spine stronger and healthier. The caveat is when I work with patients, usually we'll see their spine health improve and their structure improve, sometimes dramatically, sometimes a number of inches within weeks or months. But that also goes along restoring the health of their spine by making corrections to the spine, by making sure that the joints are healthy, that they move properly, and that they're more able to stack on top of one another. One challenge you might find with these exercises is if you're not getting the gains that you want. It could be because the underlying spine is not healthy, the underlying joints don't move properly, and while the exercise like WD-40 will loosen things up, it might not be able to straighten out the door hinge. So that is why in our office, like restoring the normal health of the joints so that they can sit comfortably, properly on top of each other by restoring motion and by restoring the normal health, that is how we get results really, really quickly. But I think that if you go through these exercises and do them regularly, you will see some improvement in your health, your spine. It will get better. How far it takes you, I don't know. It very much depends on how healthy your spine is when you start doing these exercises. So one thing I'm happy to report is that all of these exercises are really, really safe. Obviously, if they hurt, don't do them. See your medical professional. It could reflect an underlying problem. Make sure that with all of them, nice easy breaths, that especially with the reach back or with any of the exercises, you're not holding the neck really tightly. Let it be loose. Make sure that if you're moving, that with those reach backs, the shoulder leads and not the neck. And if this video is helpful, I would love to get your feedback. I'd love to see you before and after. I would love to hear how it did or didn't work for you. That would be really fantastic. You can leave a comment below. Also, please like and subscribe. It helps me reach more people. It helps me connect and do my job or reach my mission, which is to make every one of you as healthy as you possibly can be so that your health never holds you back. Without further ado, hope the exercises are great. You take care, be well.